Welcome to the NES Quantum Health Education, and today we're going to be looking at horses in particular, but we're going to be speaking to a vet, Dr Rob Willis from New South Wales in Australia, and we're going to be looking at behaviour of animals in the clinical environment. And Rob has some stories related to NES within that world, but he's also going to advise us on safe handling procedures and things to bear in mind when you're looking at the behaviour of horses in particular. So welcome, Rob.
Hey, Cyril. Yeah, thank you.
Thanks very much for joining us today. So should we start with horses in general and handling and safety of and what to look out for when it comes to horses and what types of horses may be more difficult or what behaviours to look for? Because a lot of our NES practitioners may not be very familiar with handling horses, and any advice that you can provide would obviously improve their safety and an enjoyment providing support and therapy.
Yeah, sure. No, happy to. I think horses are probably something that can have a little bit of a fear aspect for people that aren't used to being around them or working with them. And the best advice is, just work with them and have a go, because the more you work with them, the more confidence you get with them. I didn't grow up with horses myself. I obviously handled them through university, and I didn't really work with them for the bulk of the first 6 or 7 years out in practice, and then just the last 5 years it's been full-time with horses. So in some ways I had to sort of learn the animal and the behaviour and behaviour patterns and things like that all over again. So and I think the more you work with them, that fear factor drops and you get comfortable. And I think with something like NES, it's basically a feel-good treatment where they can feel it immediately, and there's a lot of endorphin release internally, and they're very receptive to the treatment. There's no pain or anything like that. So once you start the treatment, they tend to relax pretty nicely anyway. So yeah, it's a good therapy for working with horses with.
Excellent. Now, what are the telltale signs when somebody's approaching a horse? What are the things to look out for? What are the telltales that might indicate the mood or state of the animal?
Yeah, there's probably a few, and you pick up on more and more all the time. I mean, the very sort of early signs are things like, pinning their ears backwards. You probably only have to Google cranky horse or angry horse, and you get tons and tons of pictures of this, but they'll pin ears backwards. Sometimes they'll twitch their tail fairly quickly, but yeah, showing teeth, pinning ears backwards. They look strange in their face. It's a hard thing to describe, but the ears go back and out, stretches the head, and they're very expressive with their faces, horses, and you can almost see it in the faces sort of saying, I'm not happy about this. So, they can sort of motion to try and bite or attempt to bite and things like that as well. So really another good piece of advice is when working with horses, have the owner of the horse there and holding the horse for you, because they'll hold them on a short enough lead that they can't really get you and things like that. I have sort of had things in the past where people have sort of rang me up when I'm supposed to be at a horse, and I go, "Oh, sorry, we're running 15 minutes late. You just start, and we'll help as soon as we get there." And I'd encourage all the practitioners to not do that. I think that is a great way to end up in a really bad situation, and you can end up not only looking silly, but if the horse gets damaged as a result of taking fright without their owner there or something like that, it's always going to fall back on you. So just be careful with that. But yeah, their facial expressions, pinning ears back, some of them will stamp feet. Because they're a fight or flight animal, their first response is generally to avoid you. So you'll see some of them that will just take a few steps away. It's a really good idea just to hold out your hand and let them sniff it first if they're like that. Most horses, it's not a bad way to greet them anyway. Just give them a little bit of a sniff. They'll often sort of sniff you with both nostrils. Sometimes they'll go side to side. And even then, they'll still sometimes want to move away from you. There can be a point where you've got to kind of make contact and say, look, this is your session. Now I'm going to actually treat you rather than let them keep moving away. But certainly in the initial stages, if they want to break contact and suss the whole thing out initially, it's probably a great chance to just give them their space and allow them to get their trust with you. Once you've got their trust, you can really do anything.
Yeah, now if a horse is unwell, if it's running a temperature or got inflammation, what might you see the change in behaviour to be? Do they become lethargic, or what actually happens?
Yeah, sometimes they do. A lot of temperatures you might not pick up until you obviously use a thermometer or something, and the owners may have sort of just mentioned when you get there, look, it's got a temperature today, he's been off his feed, so they'll definitely go off their food and they won't be working as well as they should be. They don't always immediately appear flat when you first approach them. If they're really sick, they certainly will. They may be hanging their head down. I saw one today like that, but he's very sick. Mostly they'll look fairly similar, to be honest with you. I find that, and probably being a fight or flight animal and a prey species, they're good at hiding things. So even if they are feeling a bit off, the moment you get out of your car, you can be guaranteed they'll sort of spark up. If they are flat and unwell, if you're seeing that in them, they're quite thick. So, I suppose it doesn't necessarily make them nastier or more of a dangerous sort of prospect to handle or anything like that. To me, they'll get unreasonable if they're blatantly giving you signs that they're not happy or they're not enjoying treatment. And I'm probably more referring to some of the veterinary things or needles and things like that. If you ignore that and keep going or restrain them in a way that they can't move away from you, that's when they'll often sort of get cranky and try and walk back over the top of you. Or it's not very common to have them try and kick you, but you got to be careful that they don't take fright. I've had horses that have been perfectly fine, and you'll get a bird just fly up from down beside the stable or flash past the stable window, or you'll get a cat drop out of the rafters, or all this sort of stuff that you can't really plan for. A car backfire in the street behind the paddock, that sort of thing. And it's more that sudden take fright sort of response that they have where you could get hurt, I find, particularly with NES, more so than anything that, as a NES practitioner, that you'd be doing to the animal yourself. I think it's a really low risk therapy in terms of putting yourself in a difficult position with it, in terms of maybe getting hurt by a horse, but you just got to be smart and stand in the right position when you're dealing with them, and not sort of compromising yourself with where you might stand in terms of if they do take fright at something else. I think, if you did get hurt, it would be because you were standing in the wrong place, and the chances are they've probably taken fright at something completely irrelevant to what you're actually doing as a practitioner. I've had different times too where you want the person that's holding the horse, you want them to be paying attention. I've had younger kids that will get out the iPhone and start playing Candy Crush and things like this. I don't really know what they're on, but the moment they lack concentration, holding the horse is probably the moment that the horse is going to try and do something silly or get away from them or bite your handler. And that's a big one, to have them actually paying attention while they're doing it, because you don't want the handler getting hurt either. So you don't want yourself getting hurt, you don't want the horse getting hurt, you don't want the handler getting hurt, all three of you. And it only takes one little thing or that uncontrollable situation with that car backfiring. It's not completely unrelated to what you're doing, and the horse takes fright and runs up over the top of the handler, that you've got a problem.
So when you say standing in the right position or not standing in the right position, could you give us a bit of detail? Are we talking about not pinning yourself between a fence and the horse, or the rails and the horse, or what types of things would you be talking about?
I had a feeling as soon as I mentioned that you were going to ask that. Definitely, you just got to be aware of your surroundings. You don't want to be trying to sneak down beside a horse and say the wall of its stable, or between the fence and the horse and sneaking into places. You just want to move the horses off those structures, so if they do get a fright, and they're not going to sort of squash you up against something like that. And then just in terms of a horse's body, they can actually reach with their back feet pretty much 360 around them. They can kick to the point of the shoulder. They can go out the side, which we call a cow kick, and they can go. The most dangerous position is right behind a horse, directly behind its rump, just purely because that's where they get the most power when they kick. So you don't want to be standing right behind them, and you don't want to be standing directly in front of them. If you're checking out a knee or something on the front leg of a horse, you don't want to be bending over in front of them, because it's called striking, where they'll just really sharply raise up the front leg and snap it back down again. So basically, dead in front, dead in behind, you don't want to be. Everywhere else is fine. You just go slowly, keep hand contact so that they can kind of get a feel for what you're doing and know where you are, and just you want to be close. You don't want to be out a metre and a half away, even though the My Health will reach that distance. If they do take fright and let out a kick as they dash off or something like that, you're going to be on the end of their hook and possibly a metal shoe on the foot. You want to be nice and close, so if they do something or move and you cop a bump, it's really just going to push you off their body rather than being on the end of that limb. So all around the side is fine, both sides. But yeah, you just got to be prepared every now and again with working with horses. You might cop a knock or a bump or something like that. And yeah, I mean, it's just about risk minimisation. So the best recommendations are don't stand right behind them, don't stand directly in front of them. Same with the handler, just get them to stand on the same side of you. That's really important. That way, if they do move, you're both on the same side. And when you are approaching them from each side, just make sure to go in nice and close to them.
Yes, I've noticed myself that if I'm close into the animal and I've got my hand on the animal, constantly drawing my hand along the animal. So if I'm going to head to the hamstrings, for example, I might work my way down the back, but I've got a hand on the animal all the time, so they know where I am, even if they're not looking at me or they're looking elsewhere. And there's another thing that I sort of sense from an energetic point of view. That is, if I'm handling the animal and I'm calm and I'm relaxed and not fearful, then the animal feels that sense of security and the two of us can work together. I've noticed with some students, if they are fearful of the animal and they approach in a timid manner and they, instead of putting a firm hand on the animal and being positive with it, it's a sort of a little bit ginger, a little bit sort of just touch and go. That erraticness makes the animal fearful, and you lose the stability of that treatment sort of thing. So yeah, it is a definite case of being confident. Put your hands on them, let them feel you, let you use the device in a confident manner, and then you won't get any surprises generally.
No, I think that's a really good point. You're 100% right there. And same with riders will say the same thing. If you've got a nervous rider on the back, the horses are more likely to want to throw them off and or do something that they shouldn't. I think it's a bit of an innate response in an animal that essentially is a fight or flight animal, that they want to feel comfortable in their environment, and that includes so safety is a big thing for them. If they have someone that is nervous or afraid of them or stressed or anything like that, I think the horses kind of interpret this person isn't confident, they don't know what they're doing, so why would I let them, handle me, so to speak. And if you're confident with them and just approach them and do your treatment, the horses will relax very quickly and really enjoy it. One of my best teachers, Terry Ridgway, he's a vet and was a bit of a pioneer of acupuncture and chiropractic kinesiology and all these sorts of treatments in the US. Terry sort of mentioned to us very early days it was a bit of a difference in a line of thought for teaching vets and from what I'd heard previously, but he basically said very rarely you'll get just an outward nasty horse, but he said basically they're not nasty animals, they're very kind animals. He said you will get nasty responses from them when you do things they don't like. So if you're inflicting pain, restraining them, twitching, grabbing ears, grabbing skin, trying to put needles in them when they don't want it, he said, and their first response will be to move away from you. So initially they're going to try and avoid that, unkind sort of stimulus or sort of treatment you're trying to do. And he said, then if you suppress them or if you hold them where they can't move or you get someone on the other side, he said, chances are you are going to get kicked, you're going to get knocked, you're going to get kicked, you're going to get hit, whatever. And he said, you can hardly blame the horse for that. And I think that theory holds very true. You do get naughty horses, and for the practitioners out there that haven't done a lot of horse work, it's the kids riding ponies. It's not your big thoroughbreds that race. It's not your Arabian horses. In general, it's kids riding ponies, and most of the time it's just a discipline thing. They generally get away with murder and whatever they want with the kids, and the minute you go to do something, they just don't want you doing anything with them. There are some horses that will just be uncooperative and may from the outset sort of go, I don't like you, I don't want you treating me, and that's just how it is, and that's fine. But overall, I think, most horses, they're great. They're really good to work with. And the minute they recognise that you're actually there to help them, and they'll very quickly relax. It's a trust thing with horses, easily.
Superb. One one memory I have of treating horses was where you treat one horse and then the rest of the group want to be treated, and they come in and they nuzzle right into you and almost try and get between you and the horse they're treating, or you're treating. So they almost have an understanding that me next, please, sort of thing. It's been quite amazing treating horses from my own personal experience. Now, there is one story I wanted to share with the group who are listening. Is you and I went and saw a racehorse trainer, and there were three horses I remember in particular, and the middle one was walking backwards and forwards within its confined space, and its behaviour was so different to the other two. Are you able to share with us that story and the actual outcome as to why it was doing that and what we found in the NES?
Yeah, sure. I mean, it's where you really rely on the owners to know their animals quite well, and this one was probably a bit of an exception in that a lot of horses will have actually changed hands 4 or 5 times with different owners by the time they're, say, 9 or 10 years old. So you won't always be able to correlate the emotional panels with owners, especially if they've only had the horse 6 or 12 months. But in this case, the horse, from memory, was about 5 years of age, and the trainer had actually bred the horse himself, and he said that it always had a little bit of an anxious predisposition and an anxious nature. And that day when we were there treating his other horses, this fella, he was just sort of agitated, constantly pawing at the ground, swaying from side to side, doing all these sorts of behaviours where he was just showing agitation. And it was interesting, on his scan it showed up, I think it was an emotion. I can't remember if it was an emotion or in the belief system now, Cyril, you might remember, but it showed up red on abandonment. Do you know if that's an emotion or a belief marker? I can't remember. It might be
I think it was an isolation and abandonment. It was a combination, isolation and abandonment, and it was. I think it came up in organs as well, well as the emotions.
If it was in the and when we sort of quizzed the trainer on that, he sort of mentioned that from a young age he sort of came home and found this horse as a young foal. It was only 5 or 6 months of age or something, standing in the paddock. Its mother had died in the paddock, and he presumed it had been a snake bite, and the foal standing there pawing and sort of kicking at the mum's belly with the front leg as if, mum, get up sort of thing. And he said basically, emotionally, mentally, the foal did change from that day, and we do see that a lot in young horses that are weaned and weaned early. And yeah, it was just interesting to see that correlation in the scan, because as soon as we said that to the trainer and we said it's showing me isolation, abandonment type issues, it's, the trainer said straight away and told us that story, and it just goes, yeah, well, I can understand that and believe that. And we actually treated him with the corresponding infoceuticals, and he did really well. There was obvious changes in his behaviour. He settled a lot more. His racing actually improved as well. And it's pretty cool when you get those sorts of results and can have it correlated, because a lot of the time without the NES panels and emotion and belief sort of areas, you're really guessing at why they're showing certain behaviours. And it was nice to have that one sort of clarified for us and backed up from what the trainer had seen himself.
Wonderful. Now, how are you doing with clients who may not have ever considered their animals, in that same set of emotional patterns? They're now looking at the scan with you, not just looking at health concerns and fitness, but they're working with you on the emotions of the animal. How is that integrating? Do you finding the clients are sort of really sort of taking on that role?
Yeah, they are, and sometimes I'll sort of cautiously head into the emotion panel, because you've got to remember we're still living in an age where a lot of people don't believe animals think for themselves or have emotions. So that might sound strange to us as NES practitioners and a lot of animal owners, but there are a lot of people like that. So I'll sort of head in there and just see how open people are to those sorts of thoughts. And a lot of the time, I suppose people that do come for NES, they're already open to that anyway. So you sort of proceed, and a lot of the time it will just be incidental findings where I might be seeing the animal because it's got say a gut issue or a kidney issue, and you go, well, this is showing up too, and go, do you find he stresses at home? And just by chance they're like, oh no, he does. He doesn't really like it with this, and this. And so I find those emotions and belief panels are quite helpful. It might not be the exact emotion or the belief that the animal's having, but we imagine it's a variation on it, and that it will still respond to the intraceutical and that sort of information pattern. So I have managed to treat quite a few successfully, just even supportive, like having some ESR or chill drops at home if that's what shows up. But it's a bit of a personal thing for me. I don't kind of just give out the ESRs and the chills without a scan. Like I know people can do. I think there's inaccuracy in it, and if it doesn't get a response, you're less likely to get them to come back. For me personally, I like to actually do the scan and see, right, this animal's red on chill, not ESR, and this one's on red for love and not on either a chill or ESR, things like that. So I think if you do that, you will see changes in the animals, and particularly with the ESR, you get changes, a lot of the digestive problems as well. There'll often be correlations like we know with our human treatments. So, and I had a client that brought 2 Jack Russells in to see me, and she was just generally interested in NES, but one of them did have a bit of an anxiety disorder and was on a common veterinary treatment for anxiety. And she had tried a few different things, and none of them were really working or helping the dog. And from memory, it was a mother and her son that they owned had kept from one of the litters, and they both showed up very clearly on jealousy in the panels, and it may have correlated. I think it's an emotion, jealousy. I think it may have correlated to ESR, for example, and we put those dogs on ESR. But when the owner saw the jealousy in the panel, she laughed, because both of these dogs, all the emotions were generally clear. They were generally white, green, yellows, and then both dogs had red jealousy, and same with the son. And so the owner saw that and had a laugh, and I said, yeah, of course we know what that is. They really fight for the attention at home. They're kind of constantly at each other, these dogs, and they're fighting for the attention of at the time, I think it was the wife rather than the husband, and they're both very attached to the wife. And yeah, supposedly a lot of these anxiety issues of the dogs had come out of essentially just attention-seeking behaviour for mum. So you will find a lot of the time it's a behaviour that the owners have allowed to go on, and maybe there's not foundation discipline there in the dogs with anxiety and behavioural problems. And so, yeah, I find the NES emotion screens and panels extremely handy. And different people are receptive at different levels to them. And I guess it's just really hard to know 100%. But when you see the owners go, yes, I know what that is, or I know what that is, I often don't. I'll just show them and they'll go, oh, yeah, no, I know what that is. And you can get it correlated that way. So, yeah, I think it's really accurate, that's for sure.
Excellent. I remember you telling me about a racehorse who, if I remember, through the use of the panels, the emotional panels of the NES, they recognised that horse wasn't emotionally suitable for racing. Are you able to give us a little bit of background on that?
Yeah, this was actually probably 12 months ago. This was when I first started with NES, and they were good clients of mine, and they wanted to see what the scan would show. They basically said, right, we're not going to tell you, as a lot of racing clients do, they say, we're not going to tell you anything about this horse, except for the fact that it's not performing how we'd like. We want you to examine it and just tell us what problems you can find. And they said something like the advice we have so far is that it's not right in the back end. So I did my scan, I watched it moving. I felt right over this horse head to tail. I couldn't find any issues with its movement. I couldn't find any pain in the back end. I thought, this is interesting. I've done a NES scan. When I do it, I tend to do the NES scan at the start. So only if my palpation and poking and prodding the animal doesn't change results. And then I go back and look at the scan at the end. And I looked right through the scan, and it looked really good. Like, it was quite a clear scan, but then bang on the minds panels, and it's just red all through it. Open up the emotions, and like the emotions were like guilt, maybe anger, these sorts of things, sadness, and then you go into the beliefs, which were red as well, and it was like something good will happen. My life is full of hope. Along these lines anyway, and I thought, oh, this is interesting. I thought, I'm not sure who's assessed it and said there's something wrong in the back end, but I'm just going to have to go with one, what I've found myself, backing my own judgment, and two, this scan's actually telling me his body's okay as well. I just think he's an emotional one, and he's one of these ones that's just not going to hold up to racing emotionally. And I said that to the clients. I'm going about to cop it here, and they laughed and they said, no, that's great. They said that's exactly what we thought. They said from the word go, it's just been difficult. He doesn't seem to handle it. He gets gut ulcers easy, goes off his food the minute he walks into the barns. They said he costs a bit of money. We think he's got some ability, but basically we just don't think he's got the right head for it. And they said, we wanted your opinion, one, because we wanted to see what this machine would show us, referring to NES, and two, we just trust you, So it was nice that I kind of, very early days, I backed sort of the judgment from NES, and they were like, no, that's spot on, that's what we thought, we just wanted to have it correlated by you without knowing anything else. And they said, no one actually told us there was anything wrong in the back end, we just wanted to test you in that machine. So it was, that was a good one too, and that horse, I'm just trying to think. I don't think he ever raced. I think they pulled him out of racing, and they had tried for a couple of years to get him to the racetrack, and he just, he broke down with gut ulcers and weight loss and off his food and this, that, and the other, and time showed he wasn't going to be a racehorse anyway. But it was just interesting to see those emotional and patterns and belief patterns that this horse had.
Excellent. So that really did show early on that going for the scan, believe the scan, use it as intended, that's where the results are.
Yeah, definitely. I do find that with people too. We, as practitioners, I guess we want to practice the therapy side of it, in terms of here's the field distortions, now let's treat with this intraceutical, or let's run the ER through on these patterns, and et cetera, et cetera. But I find a lot of clients really adjust after as well, just the information within it. So you get it with emotional stuff, you get it with body stuff, you get it with, I've had, in that nutrition panel, I find gluten sensitivity quite common on race horses, or any horse for that matter. And sometimes it's just a matter of going, looks to be some evidence of a gluten issue here, gluten intolerance, which a lot of horses get wheat in their diet, and it's not wheat, barley or rye. And the minute you stop it, bang, these ulcers on and off and colic attacks they've had for the last 5, 6, 7 years, they just disappear. You don't have to work energetically in terms of the intraceutical corrections and things sometimes with them, but just being able to pick out things like gluten and say to these clients, bang, this is a problem. It can make a world of difference for the animal and the clients. And I don't know how you would find anything like that without NES. I suppose, we're looking from our mainstream stuff at either just trialing them off wheat and things, or you go to the extent of doing gut biopsies in dogs or cats on a surgical table. But it's pretty invasive and unnecessary when you can pick it up from something like NES and just do a quick, let's try it off wheat and see how it goes. And, a few weeks to a month later, he's a different horse. Right, yeah, fantastic. Move on. So, yeah.
Fantastic. Wonderful. Well, thank you very much indeed for sharing your experience, and giving us an insight into the behaviour of animals. Thanks very much indeed, Rob.
Sure, no worries.